Okay, so we have my patient, Miss Margaret Snowden here. She is 62 years old. She has breast cancer. She had a double mastectomy 2 weeks ago, and she had her drainage tube removed yesterday. So she does have low dexterity in her arms that she will be getting physical therapy for, but we just need to remember that she does have low dexterity right now. She is scheduled to begin chemotherapy soon. She is in here today with her chief complaint of root sensitivity to her maxillary left premolars, and she does have staining on her partial denture, and she has generalized bleeding on probing and slight generalized plaque biofilm and some slight supragingival calculus on the lingual surfaces of her mandibular anteriors. So to begin OHI with Miss Snowden, I would put on disease detecting liquid and take her plaque index. So because of the slight generalized plaque biofilm and slight supragingival calculus on the lingual surfaces, I do suspect that her plaque index would be higher than we like. So I would explain to her what the pinks and purples she's seeing on her teeth are, the surfaces that we see them most, and how this is of concern to her. And I would relate it to her radiographs, which show bone loss. And I would tell her that she does have periodontal disease. So then I would go into what we want to do for her to just plateau this disease and for it to not get any worse, since unfortunately it is irreversible. So first off, I would get her to show me how she brushes her teeth, and then I am going to recommend her a couple things. First, I would strongly suggest that she does invest in an electric toothbrush. Because of the decreased dexterity in her arms, it's going to be really hard for her to keep her arms raised for the 2 minutes that she needs to be brushing and making the motions that she needs to be making at the same time. So I would recommend an electric toothbrush for her, such as this. But they are kind of an investment, so if she doesn't want one or she can't afford one, if she did choose to manually brush her teeth, I would recommend the modified Bass. That also would be good for her because she does have some deeper pockets, such as going from 4 to 7 millimeter pockets, so that would help her angle her toothbrush up into those pockets. And we do see bone loss, so that would be good for that also. Sadly, as sad as this is, I don't even have a manual toothbrush in my house, so we're going to pretend like this is a manual toothbrush. I'm not going to actually put it on here because it's my husband's, but I would recommend her to angle the bristles up into her pockets, go back and forth 10 times, and then swipe down the whole way. And then where it does say that she has calculus on the linguals of her mandibular anterior teeth, I would stress, pointing this the handle up towards her nose, getting into those pockets and flicking up, and same for her maxillary anteriors. Okay, and so next I would go into her interdental care. I would recommend her to, again, invest in a water flosser, because with that lower dexterity, she's not going to have the strength and the dexterity to do the C method, I don't think. So a water flosser would be a lot easier for her. It might motivate her a little more than having to actually use floss, but if not, then I would teach her the C method and recommend that she does get floss threaders for her bridges to get under them. And then I would address, it says that she has a diminished salivary flow, so she does have xerostomia. I would, tell her she's doing a good job drinking the fluorinated water, and I would recommend a toothpaste such as Sensodyne. One, because it is for sensitivity, and she is having that sensitivity on her maxillary left premolars, and Sensodyne also has fluoride in it, so it's going to help for the xerostomia. I would again explain how she's at a risk for increased caries, and that fluoride and the Sensodyne would help to decrease that risk a little bit. And then I would recommend a mouthwash such as Biotine, because that also helps with the dry mouth. And then I would tell her that, like chewing on sugar-free gum or sucking on sugar-free candy will also help that dry mouth to kind of decrease the discomfort of that. And then she does have a partial denture, so I'm going to explain to her that it's important that she takes it out every night, because if she keeps it in, that could cause inflammation from microorganisms or the bacteria in her mouth. And she wants to brush her partial denture twice a day with a denture brush. And then she does want to clean it with chemical denture cleaners, which come in powder or tablet forms. And by doing this, I hope that she would do it at home and just plateau her perio disease so it doesn't get progressively worse, and just release stress that, especially while she's in chemotherapy and her immune system is going to be depressed, it's going to be really important to take care of her oral health at home also. And I think that pretty much covers everything.